Thank you for waiting and appreciate it. For those who are not in the room, I'm Shawn Terrell. I work for ACL. I helped sort of do what I could to help set this up. There's been a lot of people setting this up, so it's been quite an effort. And I think we have everything working now, including the captioning. So I'm just going to kick this off. This is the person-centered thinking, planning, and practice in organizations. Everybody's heard of person-centered planning. Mostly anybody in the human services system, anybody who's worked in this field at all, has heard the term, most everybody gets the values behind the term, right? It's not just person-centered plan, it's person-centered thinking, it's practice, it's person-centeredness generally, right? So it's about choice, direction, and control. It's about supporting people to live the lives they want to live in the community, with who they want to be with, where they want to live, what communities they want to be part of, what they want to do in those communities. That's the goal. That's the purpose of the system, really. I mean, and I think ACL has really, it embodies our values at ACL. It embodies it's one of the main driving characteristics that brought us all together in this agency. So while that's important, the values, the goal, the paradigm that we're in, right? That's not enough. It's not sufficient. It's necessary, but it's not the whole thing. However, we have done some work toward implementing those values, see them at the federal level, right, and states, but we're here for the now, let's talk about the federal level. CMS has implemented person-centered plans with their final rule, along with all the settings language. It's all connected, it's all supportive of each other, it's all about helping people be part of their communities and living full lives on their terms, all right? Which is a big shift, right? It really is. I mean, let's face it, it's a heavy lift. The department has issued guidance on this through Section 2402A of the Affordable Care Act. The audience for that is other agencies in the Department of Health and Human Services, including CMS, ACL, SAMHSA, et cetera. And which basically says, here's an overview of what this is. Here's how to do this work. There is a section in there that goes beyond just the planning part, but it also includes systems work that has to be done. And please implement this in your programs, other agencies at NHHS as you go forward. Historically, a lot of this has been focused on the planning part, right? So we know the values are good and it's important, and we know the concepts are there and good, but not sufficient. Planning itself is good and necessary, but not sufficient, right? Training people to just go plan, and people have their plans and they go out into the world and they meet with their providers. If the providers themselves have not been sort of trained, have not figured out how to implement these values in their work, the plans often fail, right? A lot of times they're not read. They're great, they look good, they put them in the folder, and that's the end of it. So how do you make that live? And that we immediately move into, in that discussion, in that thinking, into a systems perspective. What do providers need in order to provide person-centered services for people, to implement the plans in the way that people want them implemented? How do systems support that implementation? How do we deal with things around IT systems, policies and procedures, provider qualifications, on and on? That's why we're here today, to help think through with our guests, I'll introduce in just a second, on how do we start to build our systems to support this, so that in the end, a person gets a good life out of all this money that we're spending, right? So, so we've done some other things, I think, that help move us in that direction. The No Wrong Door System grants that we've recently put out. Over the last 3 years, I think we've developed a sense that, oh, yes, it's clear, we do have to think beyond just the planning. We have to think about how systems are constructed, how, in the case of the No Wrong Door systems, all populations, all payers, how do states then pull together all the entities, right, and all the state agencies, and really, what we really are about is getting the governor's office, in this case, in DC's case, it's the mayor's office, to buy into this and to support the integration across all the subsystems. Another value thing. Yeah, it's not just about one group or another group. Everybody needs to be dealt with and worked with and interface with a person-centered approach. That may vary to one degree or another with different groups, but in general, the concept is there. How do you do that? So we've built that into our No Wrong Door system at ACL, into our grant program. And, you know, I think now we have AARP, who is doing another round on their scorecard, and they have now No Wrong Door concept as one of their key elements. So this is another piece to this, to try to support states in developing a much more robust and systems-oriented approach to developing and implementing person-centered thinking, planning, and practice. So, that said, I think that kind of lays out, I hope that lays out everybody's sort of the expectations of what we're going to be talking about here. But I'm going to introduce Bob Williams in a minute. He's going to talk. But before I do that, I just want to introduce our panel, who graciously agreed. So in our No Wrong Door grant, the last round, picked 5 really good states, or in this case, 4 really good states and a district. There's only one district, so I don't have to say who that is. But you know, they put out just an incredibly powerful application. They've driven home to many of us how you actually do this work in systems, not just it's got to be done, like I'm saying. It's how do you do, what's the process? How do you actually approach this? How long does it take? What kind of effort do you need to make? What's the leadership structure? They have been struggling with this for now, what, 8 years? And so Laura Nuss is here. She's been, thanks for raising your hand. We don't have name tags. But she's been at this for 30 years, right? It worked in North Carolina, Connecticut, Pennsylvania, and the district for 8 years leading this effort to try to build a systems approach, not only for person-centered planning, but also for quality improvement stuff, you know, across the IDD system, primarily, and you know, employment first initiatives, okay? So she's here to talk to us about how that's been going for 8 years as well. And also Erin Leveton, if you could raise your hand. She's the program manager at the State Office on Disability Administration at the District of Columbia, Department of Disability Services, and she is now taking the helm. Is that can we say that? Perhaps, yes, on this effort. And the point, so this built up out of the IDD system, right? Built this great sort of systems level approach to doing good person-centered thinking, planning, and practice. And now with the No Wrong Door thing, it's building it out horizontally, right? How do we get mental health involved? How do we get the AAAs involved? How do we get, you know, how do we make sure the Medicaid office is really engaged in this? And by the way, the Medicaid office is going through training as well, right? And I've sat in a room with some of them, struggling with person-centered thinking and how to do this. So Erin's here as well. She's just, you have detailed biographies in your packet, so I'm not going to, I couldn't possibly do justice to all the great things everybody's done. And we have Stephen Powe. Stephen, raise your hand. Stephen's the co-vice president of Project Action, the District of Columbia Self-Advocacy Organization for people with developmental disabilities. So he's an active participant in a number of initiatives in DC. Person-centered thinking, learning, community, and supporting families, community of practice. He served on a number of boards, DC Working First Group for training people, using respectful language for people with IDD. Worked with, I didn't know this existed, it's great, Developmental Disabilities Administration Advocates Policy Review Group, the Georgetown Health Policy Project Advisory Board, and this one, the Criminal Justice Initiative to advocate for fair treatment of people with disabilities by law enforcement, which, as we know, is a very timely issue. So this is good stuff. So I'm just going to turn it over to Bob to make a few statements, and then we'll get going. We'll keep this here, boss. That's all right.
Hi, I'm Bob Williams, the Deputy Commissioner of the Administration on Disabilities and the Director of the Independent Living Administration. Good afternoon. I am thrilled to have you all here and to have Laura, Erin, and Steve here to present. I know all three and know each have powerful perspectives and insights to share with us in this room today, and those that will be able to view the session online. Most of all, I am especially pleased and proud the District of Columbia is on the leading edge of applying person-centered thinking and person-directed planning principles, policies, and practices. First, to how community living services are offered to people with intellectual and developmental disabilities, and now to how such services and supports are offered up throughout and across the long-term services and supports systems that exist in the district for people of all ages with the full range of significant disabilities. This is a huge undertaking, and I am certain it will be fraught with complexity, wicked systemic challenges, setbacks, and yes, failure occasionally. That is the dignity of risk. The point I want you most to take away is this: the transformational, seismic change in systems, and most importantly, hearts and minds, that this all is meant to bring about is simply too big and important to fail. Because the status quo is not working. It cannot work. Which brings me to a couple bits of contexts I want to briefly share. The first is some historical context, and the second relates to why this matters to ACL and all that we have to accomplish over the coming years. Most of you might not know this, but a great deal of my professional as well as personal life since 1980 has been focused on helping to enable with intellectual and developmental disabilities who live in D.C. And much of that effort centered on bringing people out of Forest Haven, which was the institution that Congress created in 1925, to in effect sentence those then labeled the feeble-minded of the district to, for their entire lives too, often for 6 or 7 decades or more. In my off time now, I am writing a book about some of those that lived there, as well as a social history, how and why Forest Haven was created. And I can tell you that much of the reason, far more than I expected when I began my research, were driven by not just ableism, but racism, sexism, homophobia, and all the other isms that are rife to this day. And it was driven by the belief that if you did not look, talk, think, and act like the rest, that the best solution for the nation was to separate and segregate you out, and most importantly, to strip you and silence you from having any say and control over how you live your life. We have made great progress, but we have far more to do and learn from people like Laura, Steve, and Erin.
Thank you. Okay. So with that, transformational change. Show us how it's done. Thank you. Laura's up first, I think. Okay.